So an imperforate anus in boys is when the anus doesn't come all the way to the skin, so the anus is actually missing. And the intestine is actually connected oftentimes to the urinary tract, and that's called a rectourethral fistula.
When we talk about a rectourethral fistula, we describe it based on where it's located on the urinary tract. So if you pretend that my hand is the bladder, my wrist is the bladder neck, this is the urethra coming down out through the penis. The bulbar urethra is actually the bend of your elbow. The prostatic urethra is where the prostate is located in the middle. And then the bladder neck, of course, is where the urethra joins the bladder. And so we'll define the rectal urethral fistulas based on their anatomical location. Of course, when you have a bulbar fistula, which is closer to the skin, or a perineal fistula, which is an opening down at the skin, the muscle complex or the sphincters are more well developed, and we can often tell by looking at the baby that the sphincter complex is there, and some people will just miss that there's no opening, and some of those babies may not be found out right away. The prostatic and bladder neck fistulas, often the babies will have a flatter bottom, meaning that they don't have that nice little butt cheek. They don't have that crease in the middle. And so sometimes when we look at the babies initially, we can almost get an estimate of where the join will be. We really define that join based on our ultrasound images and our fluoro images, so X-ray images in the end, to help us determine what type of surgery the baby will need.
There's a range of imperforate anus in boys. Sometimes there can just be a perineal fistula, so there's actually a very small opening that goes all the way to the skin, and this sometimes can be dilated to open it up more. If there's no opening at all, and there's a fistula to the urinary tract, then the intestine actually has to be brought up to the skin as an ostomy, so the stool can come out. And that's usually done within the first few days of a baby being born. And then later on, what we do is fix the imperforate anus and actually make an opening for the anus and disconnect it from the urinary tract. And that's done usually after about 4 months of age.